Recently, I had a really nice success story, a feel-good story about a patient who had had multiple surgeries in her belly and her abdomen for unrelated reasons. During those surgeries, there was a major complication where both of her ureters were injured. Those are the tubes that connect the kidneys down to the bladder. During her course of colon surgeries, etc., those tubes were injured and she had a lot of scarring in her abdominal cavity or in her belly cavity. That made it impossible for other surgeons in the future to go back into that space and fix any issues that she had. So unfortunately, this particular person was living with a tube that was in her left kidney for 7 years. That tube was changed every 3 months. And she had difficulties with it falling out by accident, causing pain, bleeding, infections. And after 7 years of living with this tube in her kidney, she came to me and said, "Please, Dr. Gonzalez, just remove my kidney. I'm done. I can't handle this anymore." She had tried to find other doctors in the area who are very good physicians, fix the problem. But unfortunately, due to the issues and calamities that she'd had inside her belly in the past with previous surgeries, it was just not possible to go back into her abdominal cavity to repair the ureter tube that connects her kidney to her bladder. And she had some damage to her kidney function overall, so I wasn't excited to remove her kidney from a medical standpoint. So I thought about something called single port robotic surgery. And that is a robot system made by Intuitive Surgical where all the instruments go through a very small incision and then open up once they're inside the body. That gives us certain advantages over the traditional multi-port surgery. In multi-port surgery, there's one opening for each instrument. If I had a pen, you can poke it into the belly, you can move that pen around inside the belly cavity. You need 4 or 5 different holes to make a surgery worthwhile. One hole is for the camera, another hole for my left hand, my right hand, etc. So you need a lot of space. With the new single port robotic system by Intuitive Surgical, I make a small incision and all the instruments sneak through that small incision and allow me to do very complex surgical procedures through a tiny hole. I also need a lot less space. So the thought process was that we can potentially fix this patient's injury to the ureter without having to enter her belly cavity. And that was going to make it possible for us to fix this. So we took her to surgery. We made a small incision in her side. We were able to kind of dig through a lot of scar tissue to get to the area where the ureter was damaged, avoiding the belly cavity completely. The abdominal cavity was never injured. And I was able to then suture her bladder up to the ureter above the area of injury. And for the first time in 7 years, she went home without a tube in her back. She was extremely happy, and as no longer needs to have the tube changes, no longer has to have a tube coming out of her side, and we're able to save her kidney, not remove it, which was a big win for all of us.